My name is Laura Rubalcaba, and I'd like to invite you here tonight to talk about an interesting problem in Sacramento region with a high percentage, a high incidence of African American child deaths. And I was recently at City Council, and I heard a presentation there about the alarming figures for this, but more importantly, what's being done about it. It's something that has the Sierra Health Foundation partnering with the County Board of Supervisors, and there's a lot of money, there's a lot of effort and a lot of energy going into it. I saw testimony for 2 hours on this. This is a big community thing. I'm very excited to have been able to get these people to come here tonight to tell us about their program, how it started, what the problem is, how they're going to fix it, and what the future holds. So, good evening, Kindra, right?
Yes.
So, get us started.
Absolutely. We're here today as the steering committee on the reduction of African American child deaths. I have the opportunity to work for the Sierra Health Foundation Center for Health Program Management, and we have partnered with the community, really awesome community partners, an esteemed steering committee that is working on not only bringing awareness to the issue, but making sure that we have solutions that follow. We have a strategic plan and an implementation plan that's going to take our community to where we need to be in the next 5 years to reduce African American child deaths.
So who else do you have here tonight?
So I have Miss Gina Roberson from the CAPC, we call it, but the Center for Child Abuse and Prevention. And I have Pastor Bobby Jones, we like to say, and he is a pastor at the United Methodist Church in Citrus Heights. But both of them are steering committee members on the reduction of African American child deaths, which is a charter committee that was put together by the County Board of Supervisors here in Sacramento.
So take us back to how this all started.
Okay, I'm gonna let Gina do that part because she was really at the start of this.
Yeah, thanks for having us. So I work for the Child Abuse Prevention Center here in Sacramento County, and we help coordinate the child death review team, and we review the death of every child in the county, and we've been doing it for 24 years. And in 2009, it was our 20-year anniversary of doing that. We put together a 20-year report, and we realized that every year we had had some kind of finding that was identifying that African American children were dying at an alarming rate, and more so than other children in the county. So when we looked at all of the data after 20 years, we realized that African American children are dying at 2 times the rate of other children in the county. And we were devastated by these numbers and realizing, especially when we had 20 years of data, that this wasn't a fluke from one year to the next. This was a significant problem. And we know that nationally this is a problem as well. So we took it to the Board of Supervisors, and Supervisor Cerna, who was a new board member at the time, was really devastated by the figures and directed the county executive to really look at this issue. He convened a steering committee on the reduction of a blue ribbon committee on the reduction of African American child death to really dig deeper into the data and see what are the causes of the disproportionate death, what can be done, what's been done in other communities. And we were able to identify 4 causes of death where the greatest disproportion was happening. Perinatal conditions, which is related to maternal health for women who are pregnant or have just given birth.
One.
Yeah. The second one is third-party homicide, so kids who are dying at the hands of third parties or strangers. And then child abuse and neglect homicides, children who are dying at the hands of their caregivers. And then the fourth cause is infant sleep-related death. And those are infants 0 to 1 year of age who are dying in their sleep.
So when we look at these child deaths, to what age are you looking to 18?
Till 18, right. 0 to 18, we review all of the death. And of course, in those 4 different causes of death, there are different age targets. So child abuse and neglect homicides was really targeted at 0 to 5. Perinatal conditions, obviously fetuses or preterm labor, those kind of things. Infant sleep related, 0 to 1, but mostly the first 6 months of their life. And then the third party homicides were mostly in the older teens, 15 to 17-year-olds. So we looked, and all of those causes of death had some kind of preventable elements. And we said if we could really drill down and see what these children are dying from and what are the interventions and the prevention methods that we could employ to really prevent them from dying and reducing the significant gap between the number of children from other races that are dying.
And I want to be really clear with the viewers that this is in Sacramento. We have a map, if you could pull up the map. We have a map that, and it shows the parts of Sacramento, and 2%, if I remember correctly, there was a map and it had on it different numbers, and there were parts of Sacramento that had more than 2 and getting towards 3, that you had 3 times as many Black deaths as you would expect for that percentage of the population.
Right. And, so what this commission did is not only did we drill down to the top 4 causes of African American disproportionate deaths, but we also isolated it to the top 6 neighborhoods. And that's what the map that you see there, and we can read the locations for the viewers in a minute. But then also, not only for the areas of the community and also the causes of death, but then also what's being done to address those and what are the proportion of African American children in those communities. And as you said, in some communities the percentage was
shocking.
Was quite higher. Yeah.
So I'm looking at Arden Arcade, Del Paso Heights, North Sacramento, North Highlands, Oak Park, and then the South area, Fruit Ridge Manor, Valley High, Meadowview, Fruit Ridge, Fruitport.
Right.
So and so your goal is to reduce those deaths by 10 to 20%.
Yeah, so
because by 2020, right?
Right. And the numbers are relatively small, so that's why there's a range. And obviously, like you said, and in the different causes of death in the different neighborhood, statistically significant reductions are different percentages. So that's why there's a wide range. But anyway, after the Blue Ribbon Commission was formed and we presented to the Board of Supervisors, all board members were on board and really wanting to support it, and they convened the steering committee, and that's where Sierra Health got involved and really convened and appointed the current steering committee members. And I think Kindra and Pastor Jones are going to speak more about what we're doing now and what we really want the community to get involved.
That sounds awesome.
So the steering committee, currently we have 32 members, and it is a range from doctors to folks such as Pastor Jones, Gina from CAPC, a really accomplished group of community folks that have come together to take on this problem. We not only came together and looked at the data, we're very disciplined about the data, but then we started to think about what were the preventable kind of interventions that we as a community come together and really put on the table as ways to solve what's going on in these communities head on. So the first thing that we did is we created a strategic plan, which really acts as our vision, our bridge into those communities to set forth the plan. We went before the Board of Supervisors saying, we have a vision. We know what we can do to help this. And they said, absolutely, we see your vision. Come back with an implementation plan. And so in June, we came back with not only an implementation plan, well, actually in October, this past October, we came back with an implementation plan that had not only kind of our vision, but the steps we were going to take to measure our outcomes, to involve everyone that needed to be at the table, and to set forth over the next 5 years. So there are 2 documents on this table that we are very proud of as steering committee members. The first one is our strategic plan, and then the next one is our implementation plan that was released right here in September. And in that plan, we get all of the wonderful pictures of folks that have really been supportive along the way, but we get the 5 priority steps that are laid out in our implementation plan, which is to bring advocacy and kind of organizing outreach to our community in a really dynamic way, to be able to organize and bring together what we're calling the Interagency Children's Policy Council at the county level and hopefully at the city level here pretty quickly, where we're getting decision leaders who are has some statutory responsibility to bear when it comes to serving children, youth, and families, to bring together their ideas in a way that uses their resources and maximizes results. We have a strategic kind of what we're calling our TARC, our Technical Assistance Resource Center.
Let's talk some more about that, because I found that really interesting. So I saw you come over to the city council, and I heard you talking, and I want the viewers to know that already you've got $1.5 million a year for the next 5 years to work on this, and that's just the money from the county, because it sounds like Sierra Health Foundation is also putting staff and talent and money into this. So there's really a lot of resource into this, and you guys have really thought out what you're doing, because to me, you're not just going after the African American child deaths, but child deaths in general, and just health. And it's, you're going to look at maternal health, and but to me, these resource systems and what you're going into the communities with the leaders, that stuff I found really, really interesting.
For us, we're being disciplined about the data. We are looking at collective impact as a way to build the capacity of our community. We like to say that we are targeted, but universal. Our goal is to reduce African American child deaths by 10 to 20%, but we know that if we do this job, we're going to actually just increase the health and well-being of youth and families throughout our county. And we're excited about that. And what you saw at the city council and the board of supervisors meetings that we've been at is not only our excitement, but our ability to organize folks and spread this kind of message of hope in our communities in a way that hasn't been done before. And so we're excited about it.
And you're going down into the communities. You're getting into the leadership that's already in those communities. You're going to have an application process. They're going to partner with you. You're going to train them. You're going to provide
and that is
resources, to build this network of communities in these different parts of Sacramento to deal with these issues, which is going to be, sounds to me like reaching out to mothers and staying with them through that the infant death time. And there's going to be so many programs, and I'm so excited that and they're going to be working side by side with people from the county.
So as I was saying, the Technical Assistance Resource Center is our capacity building initiative. We're working with the county side by side to create multidisciplinary teams inside of each of those communities, which really is just a strategic organization of resources that are already there around kind of a lot of the social services that our community already is connected to. We want to make sure that they're co-located, co-serving families from birth and beyond, and connecting in a way that's really dynamic and really brings about kind of community reciprocity. And I'll just really quickly, our next one is we want to be very, again, disciplined on the data, evaluation and accountability all throughout everything that we're done, documenting our process, revamping things that work, making sure we're filling in the gaps. So evaluation and documentation is important. And then our fifth and final is a community message. We like to say we want to be resident driven and making sure that our communication strategy, where there's folks that look like you and I that are out there that are creating a really a messaging that gets at the heart and soul of our communities. So those
really
are our priority, yes.
Well, and I think it's really important to point out, and I do want to add in terms of the resources that First 5 Sacramento has also been a great resource.
Thank you.
They actually have jumped on the bandwagon at the very beginning to start funding programs to address the
Blue Ribbon Commission was funded.
First funded.
Right, first funded by First 5 and Sierra Health, but and they really focused programmatically on the causes of death that affect children 0 to 5. So I did want to make sure that they got their plug. But I think another important thing to piggyback on what Kindra said is not only are we trying to get programs out into the community, which is what First 5 has done, which has been really beneficial, like infant safe sleep, like perinatal conditions, working with moms, but also just kind of this more systemic approach, really getting the community involved, changing policy so that these programs, if they go away, then there's still sustainable efforts in the community that are going to be long lasting.
And we talk about the really small children, but I think quite a bit of our deaths are occurring with the youth that are, over 10.
Absolutely.
There's got to be some real.
And I can let Pastor speak to that. A lot of what he's able to do in the community is support those families.
Yeah, and we see so much of our young people, and we're dealing with the post-traumatic stress impact of the death of a child. And nothing's more heartbreaking and more devastating than losing a child. And so what we find is often we're talking about mental health. We're talking about all of those issues, but how do we prevent these deaths? The faith community is used to doing the funerals and the burials and all of those things and the aftercare and trying to do all of those things, but we want to prevent those deaths. And so what we aim to do is educate, empower, and advocate on behalf of those children that their voices are seldom heard at the level where decisions are made. And so we're empowering the community to not only raise their voices, but raise the standard and the expectation. And so when we empower our young people to take charge and have a voice in their own future and to choose wisely. And so we're trying to empower, and that's our goal. And it's not about proselytizing, but our faith tells us that, we love our neighbor, not just our black neighbor, not just our white neighbor, our educated or rich or poor. It's our community, and to own that community. And so that's where we're about, okay, that baby is not just your baby, young lady. That's our baby. And we're going to hold you accountable, and we're going to empower you and teach you and show you how to care for this child, how to make your doctor's appointments. So we mentor. We put mothers, responsible mothers, with these young ladies, and we do that. And same with young men. So we're teaching them and empowering them to take charge of their lives.
It is. It's a linking up. I saw it's a lot of linking up with stuff that's already there.
Yes.
And co-location
Yes.
of your nonprofits and your counties. And then you have these great big councils, and you have all kinds of different organizations weighing in. I remember seeing that. And it also, like the DA, probation,
That's
yep,
right. Yes,
yep.
yes, yep.
Juvenile court. I
Yes.
noticed the police department itself wasn't listed in here, but I see you're getting at it in other ways. I was interested, wanted to ask you about that.
So when we started writing this, our charge was to the county first. We are a steering committee that is kind of born out of the county leadership, so we wanted to give pay our respects to that. But quickly, as you know, the city is coming on board and aligning right in sync with a lot of the efforts that we're talking about and trying to put forward. We expect, and when you saw us at the city council, it was, I told you that it had been unprecedented for the chief executive officer, Supervisor Phil Cerna, our CEO, Chad Hewitt, and our other co-chair, Wendy Petco from the Women's Health and Wellbeing Center, to really be up there together saying that we as a county and city respectfully want to make sure that you understand that these areas that we're talking about, 5 of the 6 areas are located in your city, and we want to know, would you support us too? And that was really powerful.
Mm-hmm. I think something else to point out is, not only for the county going to the city was unprecedented, but I think even within the county, all the different departments working together, coming together to really embrace the implementation plan, the Department of Health and Human Service, the Department of Human Assistance, probation, as you said, CPS, the Sheriff's Office. I mean, all of those county departments have leadership that are on the steering committee, that are invested, and really, putting not only the $1.5 million that we talked about, but also money within their own budgets to support their own programming within their, county charters and what they're assigned to do. Really having this first and foremost in their services.
Well, I'm so thrilled because this is a serious problem, and we have other problems in Sacramento, like trafficking, for instance, and it just, what's going on, and to hear that there's something, vibrant moving forward, and that you're going to not only address the problem, but also go into the communities and empower the people and the youth in those communities to be parts of the solution, to build it out, to call it what it's going to be, to plan it too. And so, do you know some of the nonprofit groups that you're going to be working with?
We really have a call out to action to all the nonprofits. If you're working with young people, youth, families, children, this this issue brings to bear for everyone who does work well in this city and county. And we're excited. We're going to be giving out grants. Hopefully there'll be competitive grants, competitive bids. But in those grants, we're asking nonprofits.
For each section, each of the 6 sections will have.
Each of the 6 sections, communities, we're asking for nonprofits to come together in ways that they never have. For you to be a nonprofit, to partner with other nonprofits, to look at our implementation plan, see what you can do good.
And be partnered right there with the city. And it's co-location.
Co-location with the county services to share.
Nonprofits co-located, working on this thing. It's just, it's brilliant. It's fabulous. I'm so excited about it.
We are too.
In addition to the nonprofits, the call to action is for all of our community, city and county. Nonprofits, CBOs, community-based organizations, and just that neighborhood mother, that neighborhood community person.
You know, a youth that hasn't had any chance to set up any nonprofit.
Absolutely.
And we're helping them with that. There are organizations in the community that we have relationship with, that we are working with, and saying, you're on board with this as well. And so our thing is, we're not being exclusionary, we're inclusionary. So we're including all of the community. And we're saying, because it takes a village, it truly indeed takes a village to raise a child. And so all of us are accountable, all of us are responsible, and all of us are committed.
Yes. Yeah. And you know, part of this is that we're talking about a heavy subject. There is no coming back from death. And when a child dies, we all lose something. And for us to be able to put out there to this community a call to action that we value children's lives in a way that is going to improve our communities is why this is so powerful.
Well, and I think too, you have that laboratory. You know, you're going to be doing things that can be replicated in other communities. You're going to be breaking new grounds. This is something this is revolutionary. This sounds revolutionary to me.
Good.
And you know, this thing that you're going to, you know, this goal to reduce by 10 to 20% over 5 years, you know, it sort of doesn't sound like that much, but when you think that you are going to build that capacity to reach that goal, so you have to build that and then reach the goal. It's a big bunch of work, and you've got a lot of people really excited about it. City Council is like, when are you coming back? When can we give these guys some money? You know, people want to be a part of it. It fits right into what City Council's doing with their priority neighborhoods. You know, there's been a feeling that the downtown has gotten all the money, you know, out of the city coffers for things, and you know, different neighborhoods have come and said that they want to get more money. So City Council is going with this priority neighborhood, and this fits right in with that. Fits in with a lot of programs they're doing, so I can see why they're excited.
Well, I think one of the things that the City Council members acknowledged was there's a sense of urgency about this issue. The longer that we wait, a child might die. Absolutely. Or you know, and there is a sense of urgency to really you know, implement something right away and show the commitment. Absolutely. One of the things that you said about, you know, being we want to be a national model. Absolutely. One of the things when we did originally when we were with the Blue Ribbon Commission was doing the research, and there's a lot of communities out there that are trying to tackle this issue. So if we can tackle it in this way and make progress, then we can, you know, inform the evidence and the research in the field to be able to replicate it and do this in other areas.
And the truth is that in Sacramento County, African American children die twice the rate than any other ethnicity. That is a hard line to say, but it's the truth. And we have to do something so dynamic and grandiose that we call attention to this topic and that we provide the solutions as well. And that's what we've done here. And again, we're extremely proud. You know, at the foundation and at the Center for Health Program Management, we're constantly working on what is our link to eliminate health disparities. And this is one of those strategies to improve the lives of youth and children in our community.
Mm-hmm. And we should say one more thing I also thought that we should say. Yes. Not only are the county agencies and the city working together, but also the hospital systems. All four of the hospital systems and the community clinics are all working together and supporting this project and all of the finding a way that they can put their stamp on it and support it and contribute to the solution. So all of the 4 hospitals have been really terrific.
Absolutely on board. They're already acting in ways that are they're changing kind of their institutional policies around sleep assessments. When you're a new mom and you have that baby at Kaiser, someone's probably going to ask you, where's your baby sleeping? And if you are evaluated and kind of known to know that you don't have a sleeping arrangement for your child, you're probably going to get a crib, and that's
education.
And education.
And education. About how
So
to
we've
safely
only got a couple minutes left. Is there anything you want to say about what you got lined up for the future before we go
Yes,
out?
I absolutely want to be able to invite our community to partner with us. We not only have really great steering committee members, but we have great community folks that are locking arm with us as well. You can reach us on our website. We have open seats, and we're also going to have community leadership roundtable applications coming soon.
That is going to be wonderful. So thank you, viewer. I think we're going to go to break now and come back with the rest of our show. Be right back. And welcome back. Here we are, Sacramento Soapbox. My name is Laura Rubalcaba. And I just want to run through our sponsors. I forgot to do that at the top of the hour. So tonight we have the Pieces Pizza for our crew. They're at 21st and P Street, downtown on the grid, and they have fabulous pizza. If you go in there, please let them know how much we appreciate their long and continued support. Our other sponsor is Humor Times by James Israel, and he does the satirical news and cartoons. It comes out every month. You can get it on subscription, or you can see it online. So we appreciate his long support as well.